Hello, this is the Community Assessment Project for the Hammond community. My name is Joanna Vicknair, and I am in Nursing 3320. To start off with a brief history of this community, it was founded in 1889 by a Swedish immigrant named Peter Hammond. It is considered the largest city in Tangipahoa Parish with an approximate population of 24,000. An assessment of this community was performed using the Community as Partner model, along with research obtained through personal interviews, a windshield survey, and various online resources such as Census.gov and the Louisiana Department of Health, generating information from within the community. Moving on to the community core. That picture in the top left corner is the actual live oak tree where Peter Hammond is buried under there in downtown Hammond. As you can see, the railroad picture there as well was pretty prominent back in the beginnings of Hammond when these railroad tracks were, the city was kind of formed around that, where timber and various crops were shipped out. Also, that Grace Memorial Episcopal Church that is listed there on those pictures as well as one of the first churches to establish services in the community. Other churches in the surrounding area include Catholic, Baptist, non-denominational, and Jehovah's Witness, just to name a few. So continuing on with the community core of the Hammond area, you can see that the median household income for that area in Hammond in 2025 is at $41,000, as that compares to the state of Louisiana a couple of years prior at $58,000. So kind of on that lower end. Poverty rate is pretty substantial at 34.9%, and with an employment rate of just half the population. Also, in regards to race and ethnicity in the Hammond area from the 2020 census, you can see specifically 4 of the most dominant ethnic groups in the Hammond community, with pretty predominant with the Hispanic population as well as African American and whites, and this will contribute to the information obtained when looking at some of the subsystems that we're going to talk about within this community core. Moving right along to that, you can see for those systems that were chosen, physical environment being the first one. The city of Hammond covers an area of 14 square miles, nestled in the lower portion of Tangipahoa Parish, with the 24,000, like was mentioned before, that currently reside there. African Americans, whites, Asians, Hispanics, again, ethnic groups to name a few. Historic landmarks, you can see the difference here in the different housing areas where you see newer subdivisions, newer homes, as well as blighted areas as well. Moving on to transportation and safety, Hammond does run a bus for its residents. For public transportation, you can also notice when moving throughout the downtown area, sidewalks are pretty predominant for walking and bicycling as well, and I did notice the residents doing that as well. Hammond police and fire departments are within pretty close quarters of each other in the downtown area as well to provide that safety for those residents as well. Continuing on with the next 2 of the subsystems chosen were communication. Throughout the area, you could notice coffee shops that did offer Wi-Fi service for inside and outside seating. There were people discussing information on local radio stations that they've heard. The Daily Star newspaper is still predominant in the area as well for getting information out to the public. And the Hammond Recreation Center does offer a good bit of communication for the residents as well. And then lastly, health and social services, and this is what ties into those ethnic groups with the concerns for diabetes and obesity up to come next. North Oaks Health System offers rehabilitation with a hospital there to offer those services for the residents, as well as outpatient clinics. A long-term acute care hospital is located right across from North Oaks for more of a rehab type of setting, to give patients options in the community. As far as insurance, regulations, to give options with that. Also, various nursing homes and the Tangipahoa Community Health Center also all offer information to the public in that area. So moving on to the perceptions of this area, we'll kind of recap with that race and ethnic population according to the 2020 census for the Hammond area. You can see those numbers of which ethnic groups were pretty predominant in that area. And then moving on to the diabetes and obesity information that was obtained through research, you can see that the adults that were diagnosed in the United States by ethnicity, you can see those percentages there, and then how that relates to the Hammond and the Louisiana areas that were researched as well. So moving on to the percentage of adults with diabetes and obesity in Louisiana, you can see in comparison from 2017 to more current times, that increase in percentages with both diabetes and obesity, and then how also that ranks in at the state level, with the how that compares also to the national level, actually, with that same kind of time frame, looking at the increase in both of those. So that's pretty substantial to see certain ethnic groups that are going to be at higher risk for developing, if they are obese and then developing diabetes, and those numbers are increasing. So again, just to kind of recap on that, that was pretty alarming also to see those numbers. But then in addition to that, specifically the Tangipahoa Parish area, the county health rankings for 2019 showed that 12% of adults in the parish are diabetic, 37% are obese, and 33% are inactive. So that's pretty substantial health risk for the community, and for awareness to really be something that should be the focus of the local groups that can help in those needs. And so that moves on to the nursing diagnosis for this community and how that relates to Healthy People 2030 objectives. So risk of ineffective health maintenance among the lower income adult population in the Hammond community related to noted poor lifestyle choices, obesity, and then just overall lack of awareness, as evidenced by the Louisiana Department of Health report card for 2023, revealing that Louisiana ranked 28% higher than the national average rate for being diagnosed with diabetes and 19.4% higher for being obese. So that's pretty substantial. When noting the Healthy People 2030 objectives, specifically on diabetes, you can see that there was an increase, or that's the goal, is to have an increase in the formal education for this particular disease process. So, there are local resources that were noted through research in the Hammond community to help try to make that a more obtainable goal. Unfortunately, you can see also, too, it was found that the U.S. had dropped 3.9% since 2017 over with adults over the age of 18 receiving that type of diabetic education. So that's something that certainly needs to be worked on. So moving on to how this relates to the Hammond community. So diabetes education, certainly as that relates to the community as partner model, is mainly prevention is key. Some of the programs that were researched found to have restrictions for the application process, but then also there were programs that were targeted at diet and med compliance, trying to minimize symptoms if patients were already diagnosed and seeking help with that type of education. So throughout the research, LSU Ag Center, the Tangipahoa Community Health Center, as well as North Oaks Health System were reviewed in their process of education for the community. With the mention of the LSU Ag Center, they did partner with the Hammond Recreation Center and had goals to raise awareness for these types of problems. Let's see, through their discussions, it was determined that the Hammond community's priorities were to improve upon a lack of education and understanding of obesity and diabetes, as well as lifestyle choices noted throughout, to offer free workshops within the community to provide education to promote healthy food choices, which would influence a healthy body weight to patients who were on a limited budget or who receive government assistance. This was also addressed at a local farmers market where they offer assistance such as the Supplemental Nutrition Assistance Program, or SNAP, that does kind of tie into farming, gardening, that type of thing, and even just lawn care overall, getting the population out and active again too. So back to the communication subsystem that the Daily Star actually offered some insight on that to kind of publicly announce to the community these programs, which is the goal is overall health and wellness. Moving on to the Tangipahoa Community Health Center, which is located in Hammond. They partnered with the National Diabetes Prevention Program, which was established by the CDC to offer diabetes education classes to the public. So anyone over the age of 18 and considered at risk for diabetes can apply for this program. But there were certain requirements that were needing to be met, such as those blood tests and elevated BMI, just to name a few. So they did offer classes that were noted in both English and Spanish to the community to try to help reach a more vast population. These nurse care coordinators assisted patients with setting goals for diet planning as well as education on insulin administration. So they do actually a monthly lunch and learn is what they called it, for an opportunity for the people to meet in person to ask questions. Even though there were restrictions in this particular area and typically these patients had insurance, they offered more assistance for different ethnic groups and, like I said, in-person meetings to kind of help address some of those concerns. And then lastly, the North Oaks Health System in the Hammond community offers a range of education resources to the community via free monthly meetings. So patients not necessarily, having insurance that needing to be there or referrals, but they did offer that through those meetings and actually blogs on their website. But they certainly did take physician-directed referrals, as noted before. The diabetes educator for this particular facility, her name is Haley Lanter. She is a registered dietitian that not only assisted patients on the inpatient side, if they're currently admitted to the hospital, but also to outpatients and their families and general population of the Hammond community as well. They did offer brochures and even cookbooks to kind of help get the community aware of what the actual American Diabetes Association did recognize as meeting standards for the education of diabetes. So this was very helpful to hear that they had a lot of material for a variety of the population of the Hammond community. So this does conclude the presentation of the Hammond Community Assessment Project for Nursing 3320.